Hello and welcome to everyone joining us at home. My name is Lisa Furst. I'm the Assistant Vice President for Policy, Advocacy and Education at Vibrant Emotional Health. And I am here today with Dr. Deb Houry, Director of the CDC's National Center for Injury Prevention and Control, also called the Injury Center, and Dr. John Draper, Executive Director of the National Suicide Prevention Lifeline and Executive Vice President of National Networks for Vibrant Emotional Health. To mark the end of Suicide Prevention Month, Dr. Houry and Dr. Draper have joined us to chat about mental health, suicide prevention, and how to care for ourselves and for each other during times of crisis. First, I'd like to give a little bit of background on each of our guests today and then allow them to introduce themselves to you in their own words. And I'm going to start with you, Dr. Houry. Injuries are the leading cause of death for Americans aged 1 to 44. Like diseases, injuries are preventable. The Injury Center uses the same scientific methods that are used to prevent diseases in order to prevent injuries. Under Dr. Houry's leadership, the Injury Center is addressing 3 urgent and related priority public health issues: adverse childhood experiences, overdose, and suicide, among other injury and violence prevention efforts. Before joining the CDC, Dr. Houry held positions at the Emory University School of Medicine and Emory's Rollins School of Public Health. She also has years of experience working as an emergency department doctor at Emory University and Grady Memorial Hospitals in Atlanta, and earlier this year held a leadership role in the CDC's COVID-19 response. Welcome, Dr. Houry.
Thank you.
And joining her today is Dr. John Draper. Dr. Draper has nearly 30 years of experience in crisis intervention and suicide prevention work and is considered an international expert in crisis contact center practices, such as hotlines, online chat, text services, and other modes that we use to support people in crisis. Since 2004, Dr. Draper has been the executive director of the SAMHSA-funded National Suicide Prevention Lifeline, overseeing all aspects of this service, including its sub-network, the Disaster Distress Helpline, and the Lifeline's partnership with the VA in administering the Veterans Crisis Line. He also serves as Vice President of National Networks for Vibrant Emotional Health, which is the administrator of the Lifeline, and he is my colleague here at Vibrant. Deb and John, welcome again. And I'm wondering for both of you, if you would be able to share with us a moment in each of your lives that helped set you on your career path or that influenced your thinking about mental health services. And Deb, I'd like to start with you. Would you like to answer that first?
Sure. So I think for me, it comes from the time I've spent working in the emergency department, because you'd see so many people come in times of crisis. And I always kept thinking, you know, what led up to this emergency department visit? How could we have prevented the way they were feeling or a suicide attempt? And then when I came to CDC, I could see all of the preventive measures and the role of public health and how we could prevent people from being suicidal. And I think for me, I go back to those patients I've met and seen and helped. And then with CDC, looking how can we have that population level impact?
Terrific. Thank you for that, Deb. John.
So I had a really seminal moment with my very first job outside of my post-grad internship experience on a mobile crisis team. I was a psychologist I had never even heard of a mobile crisis team. I had no idea what it was. But what I learned very quickly is that it's a service that goes into people's homes with severe psychiatric illnesses who are so ill that they're either unable or unwilling to go get care on their own, so care has to come to them. So here I was going into homes all over Brooklyn, which is just magnificently diverse, and walking into the lives of people who were ill. And at first it was daunting, but very quickly I realized, my gosh, this is the way care should be set up. We should be bringing mental health care to people, because some people, in fact, a number of people are so depressed they can't even get out of bed, much less get to a clinic. Our system wasn't really set up to care for people like that. And it occurred to me as I was actually serving people in their homes, working with their families, working with them in their lives, I could see how bad things were, literally, in their home. I could also see what was important to them. I could see who was important to them. I could assess the nature and severity of their risk and situation in a way that I could never be able to do in their office. And I thought, my gosh, we need to bring mental health care into people's lives rather than bringing people's lives into mental health care. So when I got my first opportunity to run New York City's first crisis hotline, which was called LifeNet, run by Mental Health Association of New York City, which is what Vibrant used to be, I thought, my gosh, this is a way to actually get into people's lives by their phone, getting them at 3 a.m. whenever they need it. And so that's what I've been devoted to ever since, is bringing mental health care to people by making it as accessible to them when, where, and how they need it.
Thanks to both of you for sharing your stories in that way and what got you set out on the path that you're both on to make people's lives better and better. As I mentioned earlier, September is Suicide Prevention Month. And John, why is it important that we raise awareness of suicide prevention after September?
Well, Lisa, we have a lot of work to do. As we know, this is not a problem for September. It's a problem for every day. It's a problem for everywhere in the United States. It's actually a problem everywhere in the world. But here in the United States, we're seeing suicide rates at 30% higher than they were at the turn of the century. And among younger people, between the ages of 18 to 25, we saw a 10% increase the last time we were able to obtain national data from the CDC. A 10% increase with one group in 1 year. And so, again, a signal to me that we not only need to promote the awareness of the problem, but most importantly, the awareness of how to prevent it. And we need to do that day in and day out.
Deb, what would you like to add to that?
Ditto. No, I agree. I think when you look at suicide in the United States, it's not a month. It's the whole year, and it's years. We had a study that came out that showed suicide rates have gone up in the United States in almost every single state since 1999. And that more than half the people that died by suicide didn't have a diagnosed mental health problem. It's oftentimes like a relationship issue or job stress that can lead to a suicide death. And so talking about suicide, reducing the stigma is so important. And I think that is what is so great about having a Suicide Awareness Month, is to focus attention on reducing the stigma.
So we have this opportunity in the year to call attention in a very public way to a public health issue that is with us all the time, to set up awareness for the rest of the year and galvanize people to feeling more comfortable accepting help and reaching out for it. I want to pivot a little bit to the current moment, or the current moment that's been 6 months long in terms of the pandemic that we've all been dealing with. And talk about how COVID-19 has made an impact on people's mental health. And Deb, I'd love to start with you. What resources are available for people who are concerned about their mental health during this time? And what can people do to help themselves and to help others while we're in the midst of this pandemic?
Sure, and I think, as you mentioned, it is about what can you do to help yourself and others during this. I think this is really an unprecedented time, and certainly the level of stress, anxiety, disruption to jobs and to schools, that really, breaks up a lot of the connectedness and social supports people have. And so I think you figure, how do you get some of those social supports and connectedness back? And so it could be with some of the public health measures we now have in place to protect people from COVID, like physical distancing. That makes it harder to have that connection, but connection is what is protective and what people really need. So whether it's Zoom, like we're doing now, to maintain some of those conversations, or maybe a bike ride outside with a friend, things like that, to where you can still have some connectedness with people is really key. I also think where you can, to have that sense of normalcy. I know that for myself, even when I was working from home, I made sure I had a routine. I got up, got dressed, tried to do everything at a normal set time so that I was building my own kind of resilience bank, as I call it, to make sure that I had good coping skills, was in a routine. I think we also need to realize that this can go on for quite some time. And so people really need to engage others, whether through school, faith community, neighbors, on how can we support each other. And I think this is where too, as we were talking about Suicide Awareness Month, you know, watching out for our friends and colleagues and family and asking, how they're feeling and how they're doing is really key. On our website, certainly on Lifelines, we have resources. And I know John can probably talk a little bit too about Be the One To and some of the 5 steps. I think those are really critical resources. So I'll stop there and love to hear from John.
Yes.
Deb, yeah, you said a lot of it. I mean, and really the social supports and routines are going to be crucial for all of us to continue to get through this. It's such a challenge to be experiencing something that is uncertain. We don't basically know when this is going to end. It's something that's outside of our control. We don't have treatments. We don't have cures. We have masks that we have, and also social distancing, which I prefer to call physical distancing. But the other issue is that sense of endurance, that it's going to keep on going, and we don't know for how long. So what we need to talk about is not recovery. It's not something that just happened that we're recovering from. It's actually, how do we successfully endure this? How do we continue to stay afloat and actually perhaps even prosper to some degree and feel productive? Because things can feel out of our control when we begin to focus on all the things that we're uncertain about and the future and when things are going to happen or not going to happen. It's really important to redirect our attention to the things that are within our control. And there's a number of things that you mentioned, Deb, that I just want to underscore and maybe put them in a slightly different light. There are things that we can do for our social connectedness or our social health. There's things that we can do for our physical health. There's things that we can do for our intellectual health, what we can be learning during this period. There's things that we can be doing towards our spiritual health, what we can give back to, what we can contribute to, things that maybe are larger than us or meaningful. There's also our occupational health, ways in which, even if we don't have a job, how can we be building our skills at this time? How can we find ways within these little spheres of various aspects of our health? Like, I may have good physical health, but how's my emotional health? What can I do for that? So setting small goals that are within your control and begin to make progress, take steps in that direction. And as you're focusing on these small goals, you're putting one step slowly in front of the other. And that's how we eventually get through this. And there's obviously ways that we can be helping others too. You mentioned, Deb, or Be the One To, which is basically BeTheOneTo.com. It's 5 steps that people can take to help others who are in crisis, in this case, suicidal crisis, but really anybody in crisis. Specifically, there's, asking them, checking to making sure that they're doing okay, and asking them directly how they're doing. And if they're not doing well and they're feeling hopeless, ask them directly about feeling suicidal. And then how do we be there and listen to them, be present for them, being non-judgmental, not trying to fix the problem, but letting them know that they're not alone and they don't have to go through it alone, and you're going to be there for them, and also help them get connected to help. And that's another big piece of it, is connecting to help, and also keeping them safe in the event that they are at risk, and perhaps if they have a gun or pills or something like that, holding on to that for them, or making sure that these are stored in places where, until they're feeling better, that they're not going to hurt themselves. And then also following up and checking on them after they've been connected to other resources and other help and other supports in their lives, letting them know that you're still there for them, and check back with them. These are all things that we could be doing to not only help others, but boy, staying connected with others in any way and helping them also helps us.